So pancreas cancer treatment depends on the stage of the disease. Stage 1 or stage 2 cancer, wherein surgery is the treatment of choice. If the tumor has shrunken to a significant size, then we proceed with surgery. So stage 4 pancreatic cancer, the mainstay of treatment is chemotherapy. There are certain newer advancements in pancreatic cancer treatment as well. How do we treat pancreatic cancer? So pancreas cancer treatment depends on the stage of the disease. If a patient presents to us coincidentally in early stage of pancreatic cancer, then surgery is the mainstay of treatment. So early stage in the sense the cancer is localized to only one part of the pancreas and it has not spread to adjacent areas and it can be easily excised. So we call it a stage 1 or stage 2 cancer, wherein surgery is the treatment of choice. Now following surgery, pancreatic cancer has a high risk of relapse. That is the reason we ask the patient to undergo adjuvant chemotherapy as well after surgery to reduce the risk of relapses. Now when it comes to stage 3 pancreatic cancer, which means the cancer has spread to the adjoining structures, it is locally advanced. In that case, we divide the pancreatic cancer into two types. One is a borderline resectable pancreatic cancer. Second is an unresectable pancreatic cancer. Now borderline resectable pancreatic cancer, what we do is we give chemotherapy to the patient for some cycles, say about 2 or 3 months of treatment, and then we reassess the patient. If the tumor has shrunken to a significant size, then we proceed with surgery. So this is how we treat a borderline resectable pancreatic cancer. When it comes to unresectable pancreatic cancer, we treat the case just as any other stage 4 or advanced stage pancreatic cancer. Now coming to the treatment of stage 4 pancreatic cancer, well, the treatment intent itself is very different for pancreatic cancer. Here we are looking at only extending the survival of the patient. We are not looking at cure of the disease. So stage 4 pancreatic cancer, the mainstay of treatment is chemotherapy. Now this has to be continued as long as the patient is able to tolerate the cancer or the patient has progressed on any type of chemotherapy. Now this is the mainstay of treatment for advanced stage pancreatic cancer. There are certain newer advancements in pancreatic cancer treatment as well. So for stage 4 pancreatic cancer, we have some newer modalities of treatment such as immunotherapy. Now immunotherapy is a modality of treatment wherein we are boosting the patient's T lymphocytes. That means we are boosting the patient's immune cells to fight against the cancer. So this is more like a natural process which we are allowing to happen so that the patient's immune system fights against the cancer cells. But not every patient is eligible for immunotherapy. There are certain markers for immunotherapy. If those biomarkers are positive on the cancer tissue, which means on the biopsy sample, we do certain special tests. If those tests come as positive, then the patient is eligible for immunotherapy and they have very good responses to immunotherapy. If the marker is negative, then immunotherapy cannot work. So this is one form of treatment. Now the other latest update in treatment of pancreatic cancer is targeted therapy. Now targeted therapy, the name itself is self-explanatory. We are finding certain mutations on the cancerous cells which can be targeted by our medicines so that they do not damage the normal cells in the body. So one such example of targeted therapy is we are identifying a mutation called as BRCA1 or 2 mutation in the patient's tumor cells. If the tumor cells are positive for this particular mutation, then we can use certain tablets which are against these particular mutations. This we call it as targeted therapy. The advantage with targeted therapy is that there are minimal side effects as compared to chemotherapy. It has more specificity and we can use it for a prolonged duration without much side effects. So these are some of the latest advancements for pancreatic cancer apart from chemotherapy. Now in some cases, pancreatic cancer may be genetic also, but it is not very common. Genetic cases of pancreatic cancer, they usually present early to us and they are very aggressive in nature as well. So for them, we ask for a genetic testing. We confirm the nature of this particular disease, whether it is really genetic or not, And in such cases, we can still use targeted therapy, which I had mentioned earlier. So these are some of the treatment modalities for pancreatic cancer. How to prevent pancreatic cancer? Are there any ways to prevent pancreatic cancer? Well, most of the times we do not have a cause for pancreatic cancer, but sometimes in patients who have consumption of alcohol or who are tobacco smokers, cigarette smokers, these people are more prone to develop pancreatic cancer. So avoiding alcohol, avoiding cigarette smoking can to some extent reduce the risk of pancreatic cancer. Apart from this, maintaining a healthy lifestyle, keeping the weight in check, avoiding processed foods, avoiding foods that are high in trans fats especially, consuming fruits and vegetables, these are some of the important measures with which one can protect themselves from pancreatic cancer. As the rule goes, prevention is always better than cure. These things have to be kept in mind for prevention of pancreatic cancer as well. Along with this, patients who have a family history of cancer, especially pancreatic cancer, they should undergo a regular screening as well, as mentioned by the oncologist. So on that note, I conclude this video. If there are any questions pertaining to this, please feel free to approach my team. Thank you so much.